John Plus Newsmaker starts now.
Thanks for joining us on Newsmaker. 24 million Americans are enrolled in the Affordable Care Act, better known as Obamacare. And unless Congress does something, 20 million will see their insurance premiums double next year. So what are the options as the drop-dead date is fast approaching? Michael F. Cannon is the Director of Health Policy for the Cato Institute. That's a libertarian think tank. Michael, thank you. Appreciate you being here.
Thanks for having me.
Okay, where are we on this? What are the options? Just kind of lay it out for us.
So on January 1st, premiums will go up in Obamacare plans by an average of 26%. At the same time that some of the subsidies that are available for people in Obamacare plans are going to disappear. So some people who are currently paying maybe 0 to 10% of their premiums are going to have to pay maybe 10 to 20%. Whereas wealthier people are going to have to pay 100% of some pretty hefty premiums. And that has not only Obamacare enrollees worried, but also Obamacare supporters worried, because what's happening here is people might see more of the cost of all of the regulations in Obamacare that are driving up premiums.
Michael, 24 million Americans out of the entire universe of Americans, 340 some million Americans. It's not a huge chunk, but it's significant. Who is on Obamacare currently?
These are folks who generally don't have access to other sources of health insurance. They don't have access to employer-sponsored insurance or to the Medicaid program because they make too much money, or Medicare because they're able-bodied, not yet age 65. And if you're not eligible for any of those other options, Obamacare is there and you can enroll in it. Now, the government does offer subsidies to moderate income people to help them pay those excessive premiums. And in 2021, Democrats added some what they call enhanced subsidies for a little more money for the people making, families of four making up to $128,000, but also significant money for people making $200,000, $300,000, all the way up to $600,000 per year. Those enhanced subsidies go away. The subsidies for the moderate income people will still be there, but as I say, more people are going to see the cost of these regulations that are increasing their premiums, and Obamacare supporters are worried about that because they think that means that there will be less support for and more opposition.
That has not happened, and pretty much the promise of Obamacare, the idea of bending the cost curve down, that just has not happened.
Obamacare absolutely has not reduced health care costs or prices or spending. I think it's had the opposite effects. And when President Biden put these temporary subsidies in place, he was thinking, you know what, Obamacare enrollment has stagnated and we need to build broader support for the program. And if you're a politician, one of the easiest, simplest ways to do that is to just spend more government money and make more people dependent on government, and then they'll vote to keep the program going. That's what Democrats are hoping will happen with these expiring subsidies at the end of this month. There are alternatives where Congress can make affordable quality health insurance available to the vast majority of Obamacare enrollees, and they can do that without disrupting Obamacare and without increasing taxpayer subsidies.
So it strikes me that the easiest path right now, going into an election year, midterms in 2026, nobody wants it on their resume if they're running for office that they were around when Obamacare premiums doubled. My guess is, let me know if I'm wrong, that they're going to okay increasing the subsidies for middle income and lower income people. They will let those go maybe for 1 or 2 years. Do you see that's kind of where Congress may be heading?
It's important to be clear about something. Obamacare premiums are not doubling. They're rising an average of 26%, but the share that the enrollees have to pay, that might be doubling from 10% of the premium to 20% of the premium.
Okay,
but
okay, that's a very important distinction.
Yeah, the taxpayers are still on the hook for maybe 80% of the premium for these folks. And the important thing is that the total premium is going up an average of 26%, which is a lot. That's too much. Again, in order to bring down premiums for the minority with the expensive conditions. And that entire architecture has so many flaws in it that we keep seeing these rising premiums like 26% this year, and leading to crises like the ones that a lot of people are facing right now. The good thing is that there is a way for Congress to provide relief to people who are struggling under the weight of these Obamacare premiums without disrupting Obamacare or expanding it. In 2018, President Trump put in place some rules that expanded consumer protections in a category of insurance that President Obama and himself and Congress exempted from Obamacare. We call it short-term insurance. That's what the law says. But President Trump said, and multiple federal courts agreed, that there's actually enough flexibility there that those plans can offer longer-term coverage to people but without being subject to the Obamacare rules that double people's premiums. And so the nonpartisan Congressional Budget Office said that those plans make comprehensive coverage, often with broader choice of providers and lower deductibles, available to people at premiums 60% below the lowest price Obamacare plans, so that people could afford this coverage without needing a government subsidy. And all Congress has to do is say, you know what, we're going to make permanent what President Trump made temporary in 2018 and then President Biden rescinded in 2024. We're just going to give people the freedom to choose their health insurance. We're going to watch premiums come down. We're going to see people get better coverage, and it's not going to disrupt Obamacare.
I just don't see them signing on. Maybe they can do it without Democrat votes.
But that's why it's so crucial to look at what happened when that health insurance relief was in place from 2018 to 2024. A lot of people would have predicted that if you give people the freedom to buy Obamacare exempt plans, that you're going to see Obamacare premiums spike and you're going to see Obamacare enrollment fall off. But the exact opposite happened. Premiums didn't spike. They went down or remained flat for the 6 years that people had that freedom to choose Obamacare exempt plans. And instead of Obamacare enrollments dropping, Obamacare enrollments increased. They almost doubled during that 6-year period. So I think Democrats should take a look at this approach, because it doesn't appear to have threatened Obamacare during the time those rules were in place.
Do they have the votes in Congress to make the change you're talking about?
You know, if I knew the answer to that question, I'd probably be getting paid a lot more, because
Yeah, you'd be on K Street and not at Cato.
Yeah, that's a $64,000 question. What will get across the finish line in the House and the Senate? But I think that approach has a lot going for it, because we've already tried it. It worked, and it didn't disrupt Obamacare.
Okay, President Trump has started to weigh in, and he seems open to expanding, well, not expanding, but extending the Obamacare subsidies that are set to expire at the end of the year. Once he weighs in, that kind of sets the marker, it seems, with the current political climate, at least for the Republicans. Is this just everybody kind of saying, we're going to need political cover next year? We can't have this affordability issue dogging all of our candidates, talking about the Republicans.
That's always a consideration, political cover is, and so is what the president says. I mean, if the president will be setting a marker or a standard, and a lot of Republicans will rally around what he says. So it's significant that the president backed down from that proposal that you mentioned. There are reports that the White House was going to endorse either extending the Democrats' temporary enhanced subsidies or taking the permanent premium subsidies and turning them into cash subsidies. Either one of those ideas would be problematic, because either one of them would expand Obamacare and Obamacare spending. Obviously, if current law doesn't reauthorize those enhanced subsidies, and authorizing them will expand Obamacare. But if you turn the premium subsidies into cash subsidies, a lot of people who won't cross the street for a premium subsidy will cross the street for a cash subsidy. You could have more people enrolling in Obamacare, and Obamacare spending goes up that way. So it is really significant that the president backed away from this, because that would be the first time that Republicans have ever expanded the Obamacare.
Yeah, well, they wanted to kill it. They voted 100 times to kill it.
Yeah, and another benefit of the approach that President Trump took in 2018 is something that he can already get his head around, that he can sell really well to Republicans, and he even has a message that he can take to Democrats. This isn't something that you should fear.
Michael, what went wrong with Obamacare? Pretty much everything promised has not come to fruition, and premiums have skyrocketed. Care is not very good, maybe even worse. What happened?
Obamacare's architecture contains just a lot of basic structural flaws where you're trying to get people to act in ways that are contrary to their own financial, immediate financial self-interest, and that's just not sustainable. People aren't going to do that. So one of President Biden's economic advisors, an economist named Michael Caruso, he looked at this guarantee that Obamacare provides that it will end discrimination against the sick and will provide secure access to care for the sick. He looked at the provisions that try to do that are basically just price controls, or really like rent control for health insurance for sick people. And what rent control does to the quality of apartments, Obamacare has done to the quality of health insurance for the sick. What Biden's economic advisor found was that the quality of health insurance for sick people is getting worse in Obamacare. And it's because the government basically slapped price controls on health insurance. And when you have a binding price ceiling, that's what happens. Quality erodes, so that he said that it's so bad that not even healthy people can be adequately insured in Obamacare. Sick people are losing thousands of dollars per year to this form of healthcare rationing. And this is not a result of insurance company greed. This is something that insurance companies can't even stop because of the basic flaws in Obamacare's architecture. There are better ways to get people to keep the promises they make to the sick. And that is another reason why the approach that President Trump took in 2018 is so important. We need to let people experiment with different ways of trying to keep their promises to the sick, just in case Obamacare isn't perfect, just in case the people who put Obamacare in place don't know everything. We should try other approaches and see if something else works better.
Final thing, just crystal ball this for me. Where do you think we're going next?
As Winston Churchill said of the United States, they always do the right thing after they've exhausted all the alternatives. We're exhausting a lot of those alternatives right now.
That's a great
Obamacare,
quote.
when it comes to Medicare and Medicaid and the massive amounts of deficit spending that we're using to finance those programs and put people who depend on those programs in a very vulnerable situation. My hope is that Congress will return to individuals the freedom to make their own health decisions. If you want to subsidize people through the Medicare program, just give those enrollees cash, let them choose their health plan. But let people choose health insurance that is exempt from all of Obamacare's rules. See if, as the evidence suggests it will, those plans provide better access to care at a lower cost than Obamacare does. My hope is that that's where we are headed. I hope we don't exhaust too many more alternatives before we get there.
Okay, Michael F. Cannon, the Director of Health Policy for the Cato Institute. Thank you so much, Michael. Appreciate it. Happy holidays.
Thanks for having me. Happy holidays.
We'll see you soon. Coming up next on Newsmaker, Arizona State Land Trust is sitting on billions of dollars that could fund education in this state, perhaps to the tune of $140 billion. We're going to take a look at that next on Newsmaker.